Hello. So I just want to bring to the stage Geraldine, if we put you in the middle. So Geraldine is part of the Diabetes Technology Network. Shall I let you introduce yourself? There you go.
So I'm Geraldine Gallen. I'm Type 1 Service Lead at King's College Hospital in London. I'm also on the committee for the Diabetes Technology Network. So this is my joy, really, to come and talk about diabetes tech. And yeah, it's great. What a fantastic day is what I was going to say, to have DSNs all in the same room together. I've got to take my hats off to these guys up here, so well done.
Okay, so are you ready for the robotic age? I think we've just come back from EASD and we took lots of pictures of different things. This year is definitely the year of the CGM. That seemed to be most of the things that we saw there. But we're just going to go through a few of them, just kind of update you on things you might be seeing in the future. So this one is called the iCan. I don't know if you want to talk about it as well. Or so it's 15-day wear, waterproof, 8 feet, 3-minute readings. Looks very much like a Libra. You can put it on your abdomen, so that's probably the main difference there. Looks very similar to Libra, I think. Do you think, Geraldine?
Yeah, I think what we're going to find is that we're going to get lots and lots of similar sensor devices, which I think we'll see a sample of which, some of which will kind of die a death because they won't quite reach market, some of which will be great competition for what we've got available. And I think that's what's really exciting, is that sometimes we don't have, we have sensor issues, sight issues and so forth with different people. And I think it would be really important that we have choice for people that are out there.
So I was just going to ask, is there any, and I think there was a bit of discussion about, do you remember when we had all the CGMs coming to market and some of them weren't quite tested on very many people with type 1, but they got to market, etc. Was there some talk about doing a kind of standardization of the MARD and making sure that it was tested on a certain amount of people with type 1 if we're going to be using it on that group, etc.? So is there anything planned or is that due? Or?
There is lots of discussion happening at the moment. Yeah. Whether there is anything planned to change, I'm not quite sure yet. Okay. I know John Pembleton, who's a dietitian in Birmingham, is leading a consensus group to try and make sure that when we bring sensors to market, particularly if they're going to be linked with automated hybrid closed loop as well, that these sensors have accuracy and have data to come with them, but they're robust data. And I think that's been the problem that we've had in the past. We've had technology come with CE marks, FDA approval, but actually the accuracy data has not been great. They've often gone off other companies' data as well. And actually we've also found that, they're not always tested or researched in the group that we want to use them in. So we do need to have, because seeing this is technology in diabetes, it's not already gone bang. It's going to absolutely go, there's a whole tsunami coming in our direction, which is really, really exciting. But we've got to make sure, we've got to sift through the rubbish, in all honesty, to make sure that we're getting good devices onto good people to, so that they see the benefits.
Yeah, absolutely.
For anybody that hasn't seen this one, this is an oldie, isn't it? A few years ago, this was kind of brought to diabetes services as the next best thing, which is an implantable device that healthcare professionals would have to implant. The needle for it looked huge. If anybody's had their animals identi-chipped, it was very much like an identi-chip needle that you would have to have put under your skin, and then the sensor bit injected, and then it has a transmitter over the top of it. The good thing, I suppose, is it lasts 6 months, so you're not having to do it absolutely loads, but it still had calibration needed, so you were still doing finger prick tests. And it's upper arm wear only. So widely used in Europe. Whether it will come back to the UK?
I think it might, actually, because it's not died a death. It's still there, and it is used a lot in Scandinavian countries. I think what we might find with Eversense is that when we're looking for the kind of plug-and-play hybrid closed-loop systems, and at the moment, ever since the cost to insert the device, because you have to have a sterile room, it's a sterile procedure. At the moment, we can't provide that. And when it has been provided in the UK, it's mainly been in private settings. And I think as this evolves, we actually might find that we've got a sensor that someone comes in, has it inserted, is there. We get rid of the kind of skin adhesion issues, the changing, it still is day-to-day burden that people with type 1 are having to live with. And this hasn't gone away. And I think if they can find a technique where we can get it in easier at a lower cost, then actually I think you might find that they are talking to some of the other companies in America that are going through FDA with regards to these more kind of fully closed-loop systems. So I think it's not quite gone away. I think it's watch this space.
Yeah, it's massive though, isn't it? I mean, the little sensor's small, but that thing on his arm, that's giant. No one's going to want to wear that. I wouldn't want to wear that.
No, I think the technology's still got to improve with it.
So this one looks very similar in colour to a design that we see a lot, green and orange. Anytime CGM. But this one lasts for 2 years. It's rechargeable. It's 14-day wear, and they give you two, so you can charge one whilst you're wearing the other one. But completely plagiarise the colour scheme of green and orange here. Anything to say?
Yeah, I don't know much about this one, I've got to say.
No, it's a smaller, so that insertion device was actually a lot smaller. If you think that anytime thing's in my hand there, that device is this big. So compared to the waste that you see from other manufacturers, this was smaller waste. That's all I can say was different.
And I think that's when I looked, because I saw some of these slides earlier, and so I looked it up to see what is its unique selling point, because I think that's the issue with these sensors. Why would we change what we've got unless it's got a different unique selling point to what we've already got available?
Yeah.
And I think we just got to be careful with regards to how many different systems we can have available. We want choice, we need choice, but we also got to be careful how many different systems we have available. I think they're trying to sell it as kind of ease of use, but I don't really think it's much easier than what we've got available, so I'm not really seeing much difference.
Become like the blood glucose meters, where you just get hundreds of different ones, and they've had to do a whole blood glucose meter pathway now because there's just too many of them to say which ones are the best.
I was going to say the other thing to think about is how many systems we're going to have to log into for all of these. And if they all log into one, fair enough. But if we need 25 different passwords, that's a big no, isn't it?
No, when we were talking to these guys on the stand, a lot of them, because of Brexit, they're finding real trouble getting the CE approval. So I'm not sure how many of these were actually going to make it through the systems now. Symbio CGM. So we don't have this at the moment in the UK, but again, it's very similar to the other ones. We don't have it at the moment. It hasn't got CE approval. Shall I skip to the next one?
Yeah.
So this is the continuous ketone sensor. And I actually have one on, so you can see this sensor. So it's 14-day wear. It's waterproof. So I asked the guy, is it going to be, and it's got CE approval for use in this country, so that's why he's let me have one. But I said, is it going to be used for like inpatients who are in DKA, say, so instead of finger pricking their fingers every 5 minutes, he's like, oh yeah, maybe. But I've worn it for the last couple of days and I'm not impressed. It has, so when I was asleep all night, when you're starving, you think overnight it's probably going to be the time where you see the most ketones, 0. During the day, it's gone up to 0.7, 0.5, 0.7. I prick my finger and it's 0.3. So I don't know if it's actually meant for people with diabetes, really, even though they were selling it at the EASD, that it's for diabetes. But when you look at the app has, they're like actively encouraging you to be in ketosis. So it's more for like diet, that kind of thing. So when you look at the time in range, your time in range is between 0.5 and 5 or something ketones, and that's your time in range. Luckily, I'm like It's 2% time and range, which is good, I think. But yeah, there's one page that kind of says, and this is where you can tell it's not for diabetes. There's no alarms on it either. And it says your range chart. Oh, where's it gone? Oh, and it's stopped pairing now. That's the other thing. It's stopped pairing like 1 million times. Every time I go anywhere away from my phone, I have to repair it. But there's like a guide as to what your ketones are, and all the green ones are 0.5 to 1.5, 1.5 to 3, 3 to 5 is in the green, and 5 to 8 is in the yellow. So at 5 to 8, we're in hospital. We got DKA, you know. So it's definitely not for diabetes. It needs a complete overhaul if we're going to start using it for diabetes.
But just to add on to that, so I don't know much about this company, but you've certainly got a company here today that are looking at continuous keto monitoring. And I definitely think this is where we are heading.
Yeah.
I think, we're going to have CGM devices that become easier to use, smaller and better connectivity. But actually, I think we are going to have, in the not too distant future, a continuous ketone device. I'm not quite sure where they're marketing it yet, whether it is for somebody with type 1 diabetes when they become unwell, whether like Libra, they do go outside of the diabetes market for lifestyle, or whether it's going to be an inpatient. I think inpatient is a clear winner, given ketone monitoring on the wards and so forth. But I think this is a very much watch this space, because this is now going to be the next form of technology that we get to see from a lot of the CGM companies.
It would be great if it... Oh, you're on. Is this working? It would be great if it integrates. So if you had one that did glucose and ketones all together, then that would be perfect.
Yeah, that's
Switch
what
on, off.
Yeah, that's
So
what I
that
was
could be
just about
arranged,
to
that
say.
would be lovely.
Yeah.
Things stuck to me everywhere.
Yeah.
When I double pump.
Yeah, no. That's what I was just about to say, is that actually when you started to go up, if it had a ketone monitor almost that then kicked in and said, right, okay, your ketones are this. But obviously that is a bit pie in the sky probably at the moment, when we haven't even got a ketone one that actually works.
Yeah, my understanding it's still going to be separate device to start with, but who knows? Look at where it's going to, so... we took a picture of this just because we were looking at tech and the different forms of tech, and this was marketed as an insulin saver when you were in really hot or really cold countries, but we didn't really see the why you needed it, in a sense, because it really is only telling you the ambient temperature, so you could just put any thermometer in there, really. You don't need one specifically for insulin. So it just went in around where your insulin was in a bag or something like that, and gave you a reading.
So this was actually really quite good. So it's 3 different pumps. They hold more, they're patch pumps, they hold more units than the patch pumps that we have at the moment, so you can have up to 300 units. And this was showing you 3 different pumps. So the first pump, I think, is more aimed at type 2 diabetes. It's more a basal profile, and then if you want an extra unit or 2 of insulin, you just push a button on the side and you get a unit, 2 units, 3 units. There's no bolus calculator, nothing. It's a very simple pump. The other one is more like a normal pump. You've got your bolus, basal rate, and things like that. But the signature pump, it has an insulin pump and a CGM in one. Yeah. Woo! Yeah. So that's really interesting. Again, they were not very clear as to whether we're going to get it in this country or the CE approvals and all that kind of stuff. The way, if you see in this little picture on the right-hand side, don't know if you can quite see that, filling it was really easy as well. You just kind of like click the vial onto it and it just kind of sucks the insulin out. So it's,
Turn that blue dial thing. So you push the vial on and then turn the blue dial and it filled the reservoir.
Yeah. So a lot, simpler, no having to get air out, no having to get rid of the bubbles or anything like that.
No. But I think the signature is quite a long way off from what I got the impression, is that they're very much marketing this essential, simple pump, but that the advanced and the signature are where they're going, effectively what they're planning.
was just going to add to that, really, because if you look at where research is going, when you attend conferences like EASD, ATTD, not that we all get to attend them, I have to say, but we're now starting to see a lot of research come out around technology for our type 2, people living with type 2 diabetes. So where we're sitting here now going, how the hell are we going to cope getting everybody who meets criteria onto a hybrid closed loop system in type 1 diabetes? I think what we're going to soon see, as Partha said earlier, that's going to be standard care, and it's going to move into the type 2 diabetes world. And a lot of companies are looking at more simplistic pumps for that market. A kind of, if we think of our frailty, if we think of our district nurses who are going into people with type 1 diabetes, and we actually worsen their care because we take them off technology. So companies are looking at the type 2 market. They are looking also at kind of more simple kind of patch pumps with remote monitoring, with this built-in CGM. So again, to make a lot of people's lives a lot easier, but doesn't mean that they have to, the number of people I can think of that, because they reach a certain age, can't manage their own diabetes as well, actually gets technology taken away from them because of, community care services, and just haven't got the resources to manage that. And I think some of this actually is really exciting because it's going to help that market.
This is just showing you the T-Slim mobile app, so you can't really see it from down there, and there was no data on it when they let us take a picture of it. But just to say that the mobile app is coming, and they are using it in other countries at the moment, so it won't be long before it's used in this country. And I think that would be so much easier for people. I mean, I just get the habit of it now, and I'm just whack it out my bra and don't even bat an eyelid. But some people, they're like, what have you just taken out of your bra? And yeah, people don't like doing that, and especially if people are at school with these pumps in various places, having an app on the phone, if you're allowed phones in schools, who saw that on Twitter, you can bolus straight from the phone. And then when you look at the other picture there, that's showing you T-Slim's patch pump, the sort of smaller pump, isn't it? Is it patch pump or is it still a tethered?
It's still a tethered
Oh, it's still
pump.
tethered,
It's just
small.
the size is much smaller, yeah.
Yeah.
So, well, that is the worry, isn't it? To whether it will be similar to, the solo patch pump that's quite clunky and quite difficult to put together. But it is as small as they describe it as fitting into the kind of pocket, the top pocket of your jeans.
The pound pocket.
The pound coin pocket of your jeans. So lots of people are actually asking already about it. So it is gaining excitement. And of course, we've got G7 linking to the tandem really, really soon.
They told me by the end of the year we're over there, but whether that's true or not, I don't know. They've been saying it for a while, haven't they? Geraldine's probably not allowed to tell us.
Well, no, I was just going to say there are a couple of concerns around connectivity.
Yeah.
So just be, when we are looking at moving, because that's the thing, isn't it? We get really excited around these technology, but speak to each other, find out, for people that are using them, what are your experiences? And I think there's just been a couple of issues with connectivity with the smaller transmitter. And I think that's what's delayed. So hopefully they've overcome that. And now we can see that not only in the tandem pump, but also the Omnipod pump and more.
Have you seen this one? No. So this looks really clunky, really chunky, and it's the pump that connects to the ADEX. So the ADEX, some of you will have seen that from GlucoRx. We're not using it very much, but this is the pump that connects to the ADEX. It holds 200 units. It's not a closed loop system. It'll just be having the glucose level on there for the bolus calculator, I think. So we weren't particularly impressed with that one.
And I think, again, every time the reps, because that's what happens, isn't it? They kind of bombard you with emails to come and talk to you and everything else, have yet to show data. So I think that's the most important thing. When these things come out, well, let's see your safety data. Let's see your pivotal data on the pump systems. And if you don't get to see it, don't touch it with a barge pump.
Yeah. another CGM. Told you it was the year of the CGMs. This one's 15 days. This one is 5-year transmitter life, updating every minute. You can put notes in the app, which is good because some of our basic CGMs don't have that. So it's more like the Dexcom, I suppose, with being able to put your notes in your phone app. And yeah, this app on your phone, but probably nothing more to say about that one, is there? No. These two, the next two things, made us chuckle a little bit because this is the human version of the CGM from this company. It's a 3-year transmitter life, 14-day wear, shower-proof, not waterproof, works on an app on your phone, 3-minute readings, and you can have a follow care app. Fast forward to animals. And we now have a waterproof one, no separate transmitter. It's smaller than the human version. It's got its own app that considers species and metabolic rate, and it just looks a lot better. So this is the one on the cat. The one on the dog is the human one, I think, isn't it? The one on the cat is it looks very similar to a Libra 3, I think, doesn't it? But it does go to show the pets are more loved.
I think, I think this company had, I think it had about 4 different types of CGM. We didn't get all the different pictures, so they were a bit confusing, but definitely the animal won out over the human version, to be fair.
So watch this space if your cat has diabetes. Do you want to talk about this one, Geraldine?
Yeah, so I think this is, I've got to say, I think this is really exciting. I've just been discussing this with our team at King's this week. So this is the Simplera, which is coming from Medtronic, and it's an in-pen smart MDI system. So basically, you've got the new Simplera CGM system, which is an all-in-one system now, and no calibration. And then you've got the app on the phone, which also has a bolus calculator, and you've got the in-pen as well, which connects to the app. I think I'm quite excited by this, I've got to say. I think for people who either don't want pump therapy, and I think we've got to remember not everybody does want pump therapy, but they still want to be able to have the same benefits of pump therapy and the same consultation because the data is there with regards to, I think we're very lucky with some of the data that we're able to see with pump therapy, and we don't have that luxury so much with people that are on MDI. I think this actually, fills that gap, which we don't have at the moment. And I think equally, when we're talking about hybrid closed loops and we're talking about, people who will benefit from hybrid closed loop, particularly those higher risk people, this might actually be a really nice interim step as well to moving people to hybrid closed loop as to get into that routine of bolusing, carb counting, using a bolus calculator. So I am actually quite excited by this. And given the fact that it all talks, you said about, systems not talking to one another, the fact that this all talks together, I think the cost is a worry. And I think just this week I was asking for cost analysis from the companies. We need to see that so that we can get our payers to kind of help support it in services. But I know some services are already using it and quite like it.
Yeah, I had heard as well that there's been quite a lot of feedback going back to Medtronic about I think the pen is £100, isn't it, or something like that. And I think there's been a lot of feedback going back to them to say, actually, you need to kind of either reduce that considerably or make it free. So I know that is going back to Medtronic. I agree. I think I'm quite excited about it as well, and I've seen on Twitter, as we do, a couple of people using it and actually, giving really, really positive responses to it, because not only is it giving them a carb, bolus calculator, but actually when their glucose level is coming from the CGM, it's also giving them an idea that if they're a bit low, about having a few grams of carbohydrates, and actually kind of teaching them in a sense that they don't need to over-treat hypos and things like that. So it's giving them the education. And I agree that there's some people that maybe don't are not ready to get to a pump, or they don't feel like they want that yet. And this can be a pathway to get them there, that actually they'll feel happier to then go and take that technology further down the line. So I do think it's a brilliant sort of interim step.
I was going to ask, so you said about cost. What are you paying? So I guess you pay for the CGM, you pay for the pump, the pens, and they'll need 2 per insulin, I guess. And then do you pay for the app, or is that a free?
It's all part of the one system. So I asked for the costing over a year, and then I asked for the costing, the kind of, because apparently you are meant to change the pen every year.
Right,
That's not what the costing they gave me, I've got to say. But actually, I think when this first came out, and they've been talking about it for about a year, and my first, well, why would we use something like this when we've got Libra, which you can have the Nova Pen 6 links to Libra, and you can use that. But actually, how many people are you finding? You've got a Diabetes M app, you've got your pen, you've got, nothing's all together. And actually, the amount of people, yes, people do benefit from these, but there's a lot of people that don't move forward with this because it just is still too much day to day for every single injection. And actually, I think now, because we can't have access to Nova Pen 6, they are having... If we balance the cost, actually, of what the sensor will be, I think they've got to bring the sensor cost down to make it more widely available. And I think the company know that, because that's why they've not been out selling it. We've not seen that big sales pitch in the UK. But I think we're going to start to see it become more competitive. And actually, I think this is a really good benchmark for it, saying, yes, we will have our hybrid closed loops, but actually we can have the same quality of care for people with MDI, but it has to be cost effective, and they've got to show that as well.
I think you're right in the sense that if it all links in together, it's one less app to open on your phone, isn't it? If it's already got the glucose level in there and the directional arrow, that's some of the work taken away, isn't it, for that person? They haven't got to put that information in. So I think, yeah.
And the way I've kind of sold it locally, I've got to say, is that, this replaced the cost of a pump, so it's cheaper than a pump for those people who either meet the national criteria for pump therapy, but actually don't want it for whatever reason, or are quite high risk for pump, and this is maybe that stepping stone there. So I think we might see some data come out from them first, and then we hopefully be able to roll it out a little bit more.
That's a good top tip.
I love the idea of this.
Yeah. So we saw this, and it's basically an alarm clock, but it connects to Libra, Dexcom, Night Scout, and it's for people with a hearing impairment, so elderly people. We were saying that you could have it in a nursing home, so you have everybody hooked up to these things, and it would be like a cardiac ward where you've got them all hooked up to cardiac monitors. You've got everybody hooked up to one of these, and then it's like, which one is it? It's going off. Let's go find our patient with a hypo. So it's color-coded. You can have it really loud, you can have vibrations, and you can have it in different millimoles or milligrams, depending on which country it's for. So,
yeah, I've got to say, I love the idea of this. I think just purely for those people who are, hearing impairment and visual impairment, I don't know if it flashes. You kind of need something that's going to alert for people. Yeah, or something that's going to, whether that does it. But I kind of thought, given the fact that it was across the companies as well, and actually we talk of those that, hard to reach people that often don't get offered the tech, probably because healthcare bias, or they won't cope with that, they won't. Having something like this actually means that a lot of people, or family members, I've got to say, carers can have something that they can quite easily see what's going on and alert them. So I quite like the idea of this.
Or teenagers, maybe.
Yeah, had a rough night
put it on
out,
the TV. So it starts, woo, woo, woo. Oh, this is yours.
This is mine. So I kind of picked the ones that I kind of thought were kind of that might actually come to market, that we might actually see here within the UK. And the Islet Bionic Pancreas, they've got actually 2 pumps. They've got an insulin and glucagon pump, and then they've got, the kind of hybrid closed loop pumps that we're more used to seeing. And this pump, all you need is the weight to set it up. They do sell it very much as a kind of no carb, no corrections, no carb ratios. So this is something that we might see as one of ours, because I think CAM APS are also showing some fantastic data coming through, but actually this is another example of where we might actually see nearer to kind of closed loop technology moving forward. It's got FDA clearance, so who knows, it could be coming to these shores quite soon. It looks quite easy to set up as well. It works with FIAS, pre-filled cartridges, and the pivotal data is looking quite promising. So I kind of thought this actually might, where we have lots that come to market and we think, well, actually, what are we going to be able to use? This actually might get to that next hurdle and push through. So some of the data is looking really, really good. And this as well. So this is Bigfoot. So this is Bigfoot Loop and Bigfoot Inject. I'm not so sure about the Bigfoot Inject. So the Bigfoot Inject is basically those caps that you'd have on pens. So you could have it for long and quick-acting insulin. I don't know about you guys, but I haven't had much luck with people that have had the caps and that on pens. But for the pumpers, you've got a very simplistic pump, which again talks to an app on the phone. It works with Libra and Dexcom, and it's got FDA submissions. So again, I think you're looking at something that is going to be very, very easy to use, which will be closed loop, which links to people's mobile phones, and is kind of one of the ones that's kind of pushing through on the market, really. I don't know how much time we've got left.
We've got a while.
So I kind of put this on there because I think a lot of services, and certainly the people that I've been speaking to, and some of the work we're trying to do with the Diabetes Technology Network is, how are we all going to prepare ourselves for this tsunami of technology that's coming? And I know the room has got a mixture of primary, secondary care, other specialists from other areas, but it doesn't really matter where you work. You are going to be hit with technology. It is, it's going to be with every patient that we see. And these were just a couple of the kind of considerations that I think, all services need to be thinking about. And as we heard earlier today, the likelihood of having any money come with this is quite limited. We might have a little bit maybe, but it's not going to be as much as what we are needing. So we have to really think smart in some respects of how we're working. And that can be really hard when we're already busting a gut to just do our day-to-day work. So these are just a couple of the things that I think, certainly the last couple of years, Emma is one of the people that I work with, just in the last kind of 6 to 9 months, we've been very much thinking about our process. What are the kind of key features we need to change within our service so that we are ready for what's coming? And I think the kind of how can we make the process easier? And I think one way of doing that is having admin support. And I'm a great believer in, we need admin to do this. And I think if we're going to get any money, it's just Shane Parker's gone, but I think that might be where we get money moving forward. It's not going to necessarily be more DSNs, unfortunately. Maybe for some services who are just starting off and, but I think we're going to hopefully get a little bit more admin support. So that releases a lot of us who are doing a lot of admin work for ordering, setting up groups, dealing with, ordering inquiries with the companies and things like that, that we can bypass some of that so that we can really go to the front face and do the clinical work that we need to do. So I think it's trying to make your service as streamlined as possible. Think of your kind of processes within your service. The other area that I think, as a service, I can only say what we're looking at King's, because every service is different and every service has different resources and different priorities. But the other one is training. My first kind of aim for this year is that it doesn't matter where a patient is receiving their care, whether it be in the clinic, whether it be in the dietetic area, whether it be in inpatients, whether it be in the foot clinic, that someone can speak to that person around technology. So I think, and speak to them confidently around technology, because I think the issue is that a lot of our colleagues do not feel confident in technology. And a lot of what I've been trying to do, both through the DTN and where I work at King's, is to try and get the awareness of technology out there. So, and that's where we can help each other in some respects. I don't know what you guys do kind of locally, but I think it's really important for clinics to join their resources. You know, if you're doing a teaching session or you want to set up a regional kind of network or meeting, that's where we're going to influence technology and make sure those people are getting it.
I was going to say, if you hand that to Vicky, all about peer support and your...
Oh, you've got, yeah, I've got Mike. Yeah, so obviously I work in primary care, so I know they're not going to directly be involved in initiating, but they're going to see more and more people, aren't they, registered at their practice, going on to hybrid closed loops, for example. So I think they need an awareness as well. But yeah, so peer support, I think, and we mentioned this, haven't we, before? So where I work, one of my colleagues, so he's a healthcare professional, but he also lives with type 1 diabetes, and he's actually set up a peer support group for people using a specific insulin pump. It started off as a very small group, and it's gradually growing, and they meet, I can't remember how often, but they had a meeting last night, and a lot of the people in that group, some have had diabetes for a long time, and this is the first time they've ever had the opportunity to sit and talk to other people. Obviously, they've got two things in common. They've got type 1 diabetes, but they're using the same technology, and I just think it's been so valuable for them. He set up a website. It's now on the Diabetes UK as recommended kind of list of peer support groups, but they've really benefited from it, and they have a WhatsApp group, and they just really support each other. And I suppose we as healthcare professionals, unless we live with the condition ourselves, we can never truly understand what you go through on a day-to-day basis. Yes, obviously we're there to help and support you and guide you, but you know, I can never fully understand how that person will feel, but they get that from each other, and I just think it's fantastic. So more of that, definitely.
And I think for us to move forward to ensure that people are spoken to about technology, I think the peer-to-peer support's really going to help, because when we did the hybrid closed loop pilot for across England, we thought people would be knocking down our door to get, and don't get me wrong, some people were, so the people that were up there and knew what was going on were the first to knock at the door, but we didn't have the number of people asking about it that we thought we did. And I think there's a big awareness out there that people don't fully understand what is hybrid closed loop, what does get involved when you wear an insulin pump, what's the difference between the different systems. And actually, when they hear somebody who wears that day to day, they can see themselves in that person's experience, you know, of wearing that technology. And that's going to be a huge driver. And as I said, we're not going to have extra resources. So we can put up videos around, you know, the pros and cons of different pumps and so forth. But there's nothing more that means, you know, to somebody living with type 1 diabetes than hearing it from somebody who lives with it day in, day out, and having better understanding of the kind of trials and tribulations they're living through day to day. So I think peer support, you know, every type 1 service has to have it. We're trying to build ours. But I think moving forward for the technology, I think it's going to have to be a must to kind of support the service.
Definitely. So we've had a couple of questions come through. So several tech devices have come and gone, several in clinical use and withdrawn due to safety concerns. Do we need better testing, screening, pre-clinical use?
So I think that comes back to Beth's question earlier, that when we had kind of certain sensors that have reached the market, I can think of an insulin pump that's currently still on the market that we had to pull from the hybrid closed loop pilot, and I think that is of concern. I think there's lots happening around that kind of regulatory side of things. I don't think there's enough happening, and that's why I said kind of John Pemberton is very, very passionate around this area. You've probably seen a paper out that he's written as well, trying to make a change in that. I think it's still going to be a little while before we do see a change. I think often we feel quite comfortable when there's FDA approval, because their regulatory bodies seem to be quite stricter than the CE marking, so that if it's got FDA, you are pretty much convinced it's going to come over here to the Europe market. But yeah, I think more has to be done, and that's why I think smaller centres, when you're starting off with tech, you know, it's really important you have reps that come in and, you know, very convincingly tell you about, you know, these new devices and how they're going to help, and they can give you free samples and all of this, but get that data, has it got CE marking, and speak to others to see, you know. So one of my first questions is, well, who else is using it? And you get a good idea that if there aren't, you know a lot of the kind of bigger tech centres, if none of them are really using this, then I probably wouldn't touch it with the barge pole.
So there's a question there about NovoPen 6. I'm not sure there's an actual shortage, but I think they don't want a shortage, so they're limiting what they give to you. Because of the Traceba issue, everyone's requesting NovoPen 6 so that they can use it for their Traceba, and obviously that's creating a massive demand that they weren't probably expecting. So they're trying to limit the supply that they're giving to DSNs for free, because they used to just say, can we have loads? And they go, yeah, here you go. But now they're kind of limiting how many they give us to give out to our patients.
There's definitely no issue prescribing them, because I've prescribed a few. So yeah, there's definitely no issue there.
Yeah, I was just going to say, I think it is just trying to curtail what's happening with regards to the disposable pens. I think they're still widely available. There's no shortage, but they are now, it's just an absolute pain. So we're not getting any now in clinic at all, and we're having to get them on GP prescription, where we could have just given them out of the cupboard and things like that, which makes a big difference for inpatients as well.
I think we can merge a few of these together about, is anyone getting stressed about learning all this new tech and what education is out there? Because I think that's probably the answer to the getting stressed question, isn't it?
Yeah. So I think as the Diabetes Technology Network, we are trying to do a lot in the background at the moment to try and get the best resources to you guys. So we're looking at resource packages. So we're going to collate what other centres are doing, have it DTN endorsed, and go out regionally to areas with a study day, with these packages, with business cases, so that we can say, look, this has already been invented. You don't have to reinvent this. This is how people do showcases. This is how people do peer-to-peer support groups. This is the follow-up care plans. This is the sick day rules. This is how they do the showcases. This is, so that we have as many resources there, so that you may decide that that one's not for you and want to adapt it slightly. Well, then we'll have permission from that you can use those resources, use and abuse them to how you want to use and abuse them, and adapt them to your services. We are going to aim to go out regionally, so that's our plan if we can. We're going to aim to go out regionally. We're going to have hopefully regional champions who knows the area, to kind of not only increase awareness, but also to get people together to discuss what are the barriers within the local area and how can DTN help with that. We're going to continue some of the education that we're doing. So not only will we have these kind of regional meetings, we've still got our diabetes educators days. We've got 2 coming at the beginning of next year. So if you're quite new to diabetes technology, I think these are quite good places to start, because we do kind of CGM, connected pens, what is hybrid closed loop. It's around peer support as well, but purely just technology. And we will keep the resources going on our websites as well. So I think, if you're wondering where, I think one of the questions was, where do I go to get information and study days? I think, in all honesty, if you're linked with these guys, which you all obviously are on Twitter and everywhere else, and maybe the Diabetes Technology Network, you'll be kept up to date with kind of what's happening and that peer-to-peer support.